Hello, my name is Jyotsna Ranga, and I'm a child and adolescent psychiatrist. I work at Creighton University and CHI Health. Child and adolescent psychiatrists in the country are really concerned about rising suicide rates in children and adolescents. It is now the second leading cause of death in young people between the ages of 10 and 19. And now, with the superimposition of a global health crisis, the COVID pandemic, we're much more concerned about increased depression, anxiety, post-traumatic stress disorder, all leading to suicidal thinking and suicidal attempts. So the risk factors for suicide are as follows. The first and foremost is mental illness, whether that be depression, anxiety, post-traumatic stress disorder. The second risk factor, which is increasing now, is substance use, and the comorbidity of mental illness and substance use exponentially increases risk. In addition to that, psychosocial stressors, adversity, exposure to trauma, domestic violence, neglect, peer rejection, bullying, all of this contributes to rising suicide rates. Signs and symptoms to watch for in children and adolescents for the parents and teachers is a change in their behavior. So that can look like changes with appetite, with sleep, changes in their mood. They can get more irritable, more clingy, more restless, more impulsive. They can start verbalizing thoughts of hopelessness, death and dying. They can increase their use of substance use. They can get much, much more involved in social media and online platforms, isolate themselves. So all of these factors need to be explored further when these are noticed in children and adolescents. So children and adolescents are involved in multiple systems of care. So they're involved with their parents, first and foremost, the family, as well as schools, churches, youth clubs, etc. So I think the community partnering with the child and parent and family and identifying and exploring mental health services for a child that is flagged as potentially having some risk factors, destigmatizing the approach to mental health counseling, partnering with pediatricians in the community so that they can screen and refer children and adolescents to therapy as well as psychiatry. Those are the ways that we can potentially hold hands and move forward towards safeguarding our children and adolescents. So if you're a parent or a teacher of a child, a young person, and you're concerned about symptoms of depression and suicide risk, we can start with the school counselor, the pediatrician, who can then move that referral forward to mental health counseling and psychiatry. If you're a young person and are listening to this and feel like you cannot reach out to a parent or an adult and want to yourself make that call, please call the National Suicide Prevention Hotline.